Thank you very much, Mary. I hope you can see my screen.
Yes, we can see. Thank you.
Okay. Thank you very much for that introduction. And it was really inspiring to hear both the speakers before me. And I think this is a very important conversation, and I'm happy to be, and it's happy that it's taking place at a crucial moment in the plastics debate. And I have had the first-hand experience of witnessing how health communities' engagement in the climate and air pollution debate has brought in valuable perspectives that have infused a fresh thinking among policymakers on how to approach these issues. And doctors and nurses have become powerful advocates for championing cleaner air and climate mitigation adaptation strategies, leading to targeted policy change on several levels and investments, especially in the right places. So I think on the plastics debate, it is a very, very important and value-added constituency to kind of bring on board. And at the same time, I think the environmental groups have also seen health as a very important entry point. It has always been part of our narrative. It has been spoken about. It is very important when we make a case on environmental harms of toxic substances and chemicals, that health be the center of it. But for health advocates to actually come and also talk about it and actually come from a point of authority brings a very, very important element to the whole debate. CL has been championing the banning of cigarette butts and as single-use plastics in the plastics treaty. So I think there is an obvious and a very, very natural connection between environmental groups and health groups, which can only be strengthened moving forward. So an important from, why should the health community be engaged in the plastics treaty? And speakers before me have made their case, but I think health is now being elevated as a core issue as the plastics treaty process moves forward. Pre-UNIA and to INC1, we've seen how health has been included in the resolution text. We need to include health impacts in a criteria moving forward, and because especially when we're identifying substances that need to be eliminated, a lot of toxic substances, chemicals, certain kinds of plastics, that the debate on elimination of certain kinds of plastics and chemicals is at the heart of this plastics treaty. And I think health will be the entry point to make that argument. Healthcare professionals have an important role to play in addressing the plastic crisis. They are uniquely positioned to understand the links between plastics and human rights and human health, and can really serve as advocates for for action on plastics. And at the same time, I think they can take a leadership. Healthcare professionals can also take actions to reduce their own plastic footprint. The healthcare systems, which is hospitals and the healthcare systems, they have a huge footprint of plastics themselves. And how can they lead by example? I think that is an important element when it comes to single-use plastics, because the healthcare system is also a huge consumer of single-use plastics.
Dr. Dharmesh,
Sorry?
can I just ask you to switch to slideshow mode?
It is on slideshow, sorry.
Yeah, you just need to click on the screen so that we get to see the full screen. Right now, it is, you've got to click on that little icon that says.
Yeah, I did from my side. Mine is on full screen. I don't know
Okay.
why it's not showing on. Is it showing now?
We can see your slides, but it's only part of the screen.
That's very strange. It's full screen on my computer.
All right.
Do you think
Okay.
do you think you can share it? Like, I've sent these slides also ahead. Do you think it will help if you share it?
Yes.
Yeah.
Jean? So you'll have to stop sharing. Thank you.
Yeah.
Great. Thank you.
Okay.
Please proceed.
Yeah. So can you go to the third slide, please? Second slide, please. Yeah. That one. So I think, as I was saying, and why should the health community engage? And one important example we have from India is a doctors organization, Doctors for You. It's a non-profit led by doctors, public health professionals. They have approached the environmental court on the matter of cigarette butt pollution, and important directives have been passed in India in the matter of cigarette butt pollution. We have our own guidelines now, and the government is actually the body that is advising the government. The Central Pollution Control Board has actually recommended a potential ban on cigarette butts, or to bring it into the EPR regime. So there is already a recognized involvement of the health community on the issue of cigarette butt pollution, and I just wanted to mention it here. Next slide, please. So why, like, I wanted to just present this slide here to talk about the drive the point that doctors are the most trusted people in society at this point, and that gives doctors and healthcare professionals an unparalleled advantage when it comes to become drivers of change, because this is the triple planetary crisis that we're facing. The climate, biodiversity loss, and pollution are all interlinked, and health is a crucial gateway to address these challenges. Fossil fuel phase out and capping plastic production can become, which is at the heart of the plastic treaty debate. We are looking for capping of plastic production, and it can become politically contentious given the economic importance behind it. But health perspective has the power to depoliticize. I feel healthcare professionals and engaging healthcare professionals in this debate can bring in a sense of depoliticization, and this can become a very important driver for change and social change. Next slide, please. So how can the healthcare community engage in environmental health issues? Tobacco is a great example, and I would like to share another example, the mercury-free healthcare. And here I think this is a case study on how health sector leadership has helped build the momentum for transformational change. The beginning of century, and UNEP, of course, champion and World Health Organization, identified the adverse effects of mercury pollution as a serious global and environmental human health problem. In 96, a non-profit coalition called Healthcare Without Harm was created to educate and mobilize healthcare professionals around the links between healthy environment and healthy people. And in little more than a decade, the whole issue of mercury-free healthcare had spread across the globe. When governments actually came together in 2010, June 2010, to talk about the first round of negotiations around mercury use and regulation of mercury use in healthcare, large segments of healthcare sector had already switched to non-mercury devices. And this kind of demonstrated, this whole case study of mercury demonstrates that how it is possible for healthcare professionals to actually take the lead in transforming or achieving transformational change, making the invisible visible, practicing leadership, and also making an economic case through alternatives, because this is the main issue here with plastics as well. We need to make an economic case for alternatives. It can come from the health professionals. Next slide, please. Next slide, please. Yeah. And when it comes to plastics, we largely see the downstream waste management and recycling part of it. This is the most visible to us as consumers and citizens in everyday life. But there's a significant impact upstream. The health impacts of plastics are felt throughout the life cycle of plastics, as was mentioned by Ms. Jyoti. But the most significant impacts are felt upstream. The extraction and transportation of fossil fuels, plastic feedstocks, which release an array of toxic substances into the air and water. And they have a whole range of known health impacts like cancer, neurotoxicity, reproductive developmental toxicity, and impairment of immune system. The refining and production, which is the next stage, and manufacturing of resins, and which is where the toxic chemicals are added to make plastics what they are, different kinds of plastics, and give them their properties. This is where a large amount of chemicals are used, which I'll talk about a bit later. And they have a whole range of health impacts as well, reproductive and developmental impacts, cancers, leukemia, genetic disorders even. And then we come to the consumption stage, where packaging used in plastic packaging used for packaging everyday products leach microplastics, and these chemicals also leach into the consumer into the consumer products, and that have a whole range of health impacts as well. And of course, waste management, end of life. We know the most common way of discarding plastics in especially in the global north is to incinerate it or to generate energy out of it. And this has a whole range of environmental health challenges, right from air pollution to dioxins and furan emissions. So this is the whole life cycle of plastics. And next slide, please. These are some of the key terms we need to be aware of. This is the terms we use to refer to the life cycle of plastics and different life stages of plastics. And here, plastic feedstock, precursors, materials and products, and waste. I need to address all of these, right from precursors. I would like to note here that plastic feedstock will be left out of the scope of the treaty, as we see it now. But tobacco products, especially cigarette butts, they fall in the category of plastic products, and this should be regulated under the treaty. But I would like to insist here that we need to also deal with precursors, which are the chemicals and the building blocks of plastics, because we cannot just have a treaty that is dealing with products and waste. We need treaty that is dealing with materials. So from the time a plastic feedstock for plastic becomes a resin, so we need to look at plastics as a material and not just as a product. So that's why we need to come together as different communities. And last slide, please. And this is an important slide from the point of public health. This is a key issue of concern for health professionals and environmentalists alike. We have 10,000 chemical substances that are used in plastics, and 2,400 of them are substances of concern, which means they have known health consequences and environmental consequences. And we have very little information about the health and environmental impacts of these chemicals. So a lot of research is needed. This is why we need, doctors and scientists to actually come together and look at the relationship and the correlation between plastics use, chemicals, and public health. And I think it's critical to and there's a critical need to include health as a set of criteria, because as we go forward, we will be identifying problematic plastics in the treaty discussions. And we need to change the approach we had in the previous instruments like Basel and Stockholm, where we go chemical by chemical. Here we need the sheer number of chemicals that we're talking about in the plastics, the context of plastics is huge. So we cannot go after individual chemicals in this the way we did with Basel and we've done with Basel and Stockholm. And I would just like to end by saying that there's a scientist coalition that is already engaging with the plastics treaty process, and there's organizing ways of engaging and providing inputs into the negotiation process. So in case you would like to reach out to them or find a way to engage with them, please do get in touch with us. We'll be happy to plug you into them, into the scientist coalition. Last slide, please. Thank you.